So I'd like to share a message on Easter Sunday, 2020. Hi, I'm John Waits, a family physician that also delivers babies, leads a residency program, and together with Dr. Lacey Smith, we co-lead a network of community health center clinics in central Alabama. Our group is here for this emergent issue, just as we're here for all of your primary health care needs, and we're here for the long haul. Every one of us has been affected by COVID-19 in multiple ways, and in ways not seen before in many of our lifetimes. Like you, each of our 350 employees and their families have been affected as well, with everything from elderly parents or grandparents being at risk should they contract the virus, kids being at home out of school, the loss of household income, the loss of a spouse's job, and concerns about their own livelihood and what might happen in the economy. And of course, the ever-present fear of, will I contract this virus? And so each of us has probably been focused much more clearly on our spiritual and mental health of late. In this video, I wanted to share a reflection on weathering the tribulations in life from the author C.S. Lewis, and then also remind you of our awesome behavioral health team that's here for all of us during this time. So this extended quotation is from the opening of On Living in an Atomic Age, which can be found in the collection Present Concerns and Journalistic Essays, and was brought to my attention in the Daily. In one way, we think a great deal too much of the atomic bomb. How are we to live in an atomic age? I'm tempted to reply, why, as you would have lived in the 16th century when the plague visited London almost every year, or as you would have lived in a Viking age when raiders from Scandinavia might land and cut your throat any night, or indeed, as you are already living in an age of cancer, an age of syphilis, an age of paralysis, an age of air raids, an age of railway accidents, an age of motor accidents. In other words, do not let us begin by exaggerating the novelty of our situation. Believe me, dear sir or madam, you and all whom you love were already sentenced to death before the atomic bomb was invented, and quite a high percentage of us were going to die in unpleasant ways. We had, indeed, one very great advantage over our ancestors, anesthetics. But we have that still. It is perfectly ridiculous to go about whimpering and drawing long faces because the scientists have added one more chance of painful and premature death to a world which already bristled with such chances, and in which death itself was not a chance at all, but a certainty. This is the first point to be made, and the first action to be taken is to pull ourselves together. If we are all going to be destroyed by an atomic bomb, let that bomb, when it comes, find us doing sensible and human things. Praying, working, teaching, reading, listening to music, bathing the children, playing tennis, chatting to our friends over a pint and a game of darts, not huddled together like frightened sheep and thinking about bombs. They may break our bodies. A microbe can do that, but they need not dominate our minds. And so there are differences in the atomic crisis and the global pandemic. We're in some sense very separated in this quarantine, and sometimes we are a bit huddled together, but it definitely doesn't have to dominate our mind. And that's the point of this reading. So let's stay safe, and let's work as one toward loving and serving each other, following the recommendations from our public health officials. We pray that you find resilience and God's peace. Please know that we're here for you and that you are loved. We want to remind you that we have more than just medical services. Some of you may not have had a chance to experience this, but we have a team of people who will pray with you, and we have a food pantry and clothes closet in 2 of our counties. We offer assistance with insurance navigation and job retraining, and we've opened up a new mental health hotline. We are on call after hours, our physicians are, But this mental health hotline, if you call this number during office hours, what it does is it will bypass reception and get you right to an on-call counselor who will call you back and be able to offer you a telehealth appointment for counseling. We'll be able to talk to you about some of the things that you're concerned about and basically get you plugged in to mental and spiritual health